Hey, what's going on, guys? So for the first video of our series, we're going to go over one of the most common associated fallacies I've heard since the beginning of COVID, which is sort of this idea that the cold and flu kill people every year, so why should we worry about COVID? So I sort of had to summarize sort of the arguments, actually the response to the arguments with 3 points. The first being the idea that cold and flus are endemic. What does that mean exactly? So cold and flus are endemic, meaning they're well understood, and there's an associated way in which year over year, during the worst times of the cold and flu, they sort of have ebbs and flows in how it sort of affects society. So whether or not the cold and flu has an impact in terms of, let's just say, hospitalization, it's something that's so well understood that the healthcare system can sort of sustain that. Actually, that goes right into the idea of healthcare, which is that our health system can actually manage those ebbs and flows. But what it can't do very well is manage shocks to the system. So actually it's the exact same way as how the sort of utility companies actually deliver power. They actually understand that there's certain times of the day where there's increased requirement for power, right? So they sort of can manage in advance for that. So it's just our systems are such where they sort of reach an equilibrium and they can't deal well with shocks. So the point about the idea that cold and flu is endemic is the idea that, well, when something's endemic, that means it's something that's well understood. It appears year after year. So we sort of understand the virology of colds and flus very well, and the epidemiology. So that sort of adds to the fact that we don't understand, we understand it very well, but with COVID, we don't understand it very well, and we can't manage shocks to the system. And the thirdly being health outcomes. So we've known that COVID is more deadly, something about 3 to 5 times more than the cold, or in particular flu and influenza. And the problem is that long-term outcomes are uncertain, right? So again, that has to go with the virology, which is the idea that we don't understand it very well when it's something that's novel, and that's why it's a novel coronavirus. So with that uncertainty, our health officials sort of have to take every precaution necessary in order to be prepared for the worst. So when we have to be prepared for the worst, then you take additional precautions. So one of the things I wanted to show really quickly is that in the news there's a lot of talk about hospitalizations associated with children. So I just wanted to show that even since I think this first period was about March 7th in 2020, where we sort of see an increase in hospitalizations per 100,000 in children and adolescents of different age groups. So this was just to show that when it comes to pediatrics, our systems can take care of a certain number of children that are sick, and relatively to adults that would be pretty low. But when you sort of have this shock to the system where you sort of have these jumps that are maybe associated with COVID waves, well, the system can't sort of manage it very well. So you only have so many pediatric doctors, and you only have so many resources associated with patients. So the system works very well when we know about it in advance, but when there's these shocks that we sort of don't know are coming, and we don't know about the long-term health outcomes, well, for that reason, we need to take extra precautions. So for all these reasons, cold and flu is something, just to summarize, cold and flu is something that's well understood, and it's endemic because it's well understood. It's something that recurs year over year. Healthcare system, we can't manage those shocks very well, so therefore, when the time comes and we need to double hospital capacity, well, we don't have the professionals, we don't have the nurses to manage that. So COVID is very different for those reasons. And of course, with health outcomes, with the uncertainty about long-term health outcomes, and the fact that COVID is more deadly, and deadly referring to the Alpha and Delta strain, for all these reasons, that's why it is different than the cold and flu and why we need to take additional precautions. So thanks for watching, and we'll see you in the next video.